Thank you for joining me today. This is the part two of sleep disturbance disorders. Sleep disturbance disorders has, as we talked about, has many factors that can affect sleep. Medication treatment or treatment for insomnia, sleep disturbance include the C drugs, which is the Ambien, Lunesta, Sonata. The first line of treatment for insomnia, it is cognitive behavior therapy for insomnia. Medication treatment include medication is a conjunct. It's not the first line of treatment, but it's additive. You can add with the cognitive behavior therapy, and it is include melatonin. It includes C drugs, which is the Ambien, Lunesta, and Solanata, uh, Ramaran, low dose of Daxabine, gabapentin if they have a restless leg syndrome, GABA A receptor modifiers, benzodiazepine, even though they have a risk of tolerance, and for short term only. Cardiac rhythm for sleep disorders include cardiac rhythm is controlled. Delay sleep wake phase disorder for the teenagers, for college students, those are affected by those, and the treatment is monitoring the light time therapy, evening melatonin, gradual shifting of the sleep, advanced sleep wake phase disorders that is common for elderly, early evening sleep, early morning wakeness, shift walker disturbance. Shift walker can affect the sleep, and the symptoms is the insomnia during the required sleep period. You are working the time required to sleep. Treatment is controlling light exposure, melatonin strategy for napping, schedule management, necrolapse. So clinical features of it is excessive daytime sleep, sleep paralysis, and differential diagnosis include sleep apnea, depression, medication sedation, seizure. Sleep apnea or obstructive sleep apnea is a common, And what causes is the repeat upper airway collapse during the sleep. So person feels short of breath, frequent sleep, sympathetic activation. Risk factors of obstructive sleep include obesity, male sex, older adult, large neck, conferences, craniofacial abnormality, alcohol usage, sedation medication, and clinical presentation of nighttime is loud snoring, apnea, gasping, fatigue, headache, poor concentration, irritability. Obstructive sleep apnea has also associated with psychiatric disorders such as depression, ADHD, cognitive decline, and the diagnosis include apnea, hypopnea index. Treatment include weight loss, exercise, oral appliances to open the airway, surgery could be considered. Medication that treat will be benzodiazepine, sedative, opioids. Para insomnia, is a abnormal behavior that occur during the sleep. It's non-rhythm. Para insomnia is a sleep wakening. Person sleeps and then they wake, then they sleep, then they wake. It's hard for them to fall asleep. Rhythm sleep behavior disorder is also include failure of a normal rhythm, muscle paralysis, acting out dreams, panic, kicking, and it's associated with Parkinson's disease, dementia. Treatment will be clonazepam, nightmares can disturb the sleep, and it's associated with person with PTSD, anxiety disorder, medication. Sleep medications include the melatonin, oxytocin antagonists, Z-drugs, benzodiazepine, sedative, antidepressant medication, antipsychiatric medication like Seroquel. For children, first line is the behavior therapy and evaluation of ADHD, anxiety, sleep disturbance, autism. Those cause sleep disturbance. Pregnancy treatment, first treatment is cognitive behavior therapy of insomnia, sleep hygiene, for pregnancy women. Using medication is a cautioned. Avoid benzodiazepine. For elderly with insomnia, highest risk is risk of falls, delirium, cognitive impairment. You want to avoid giving them benzodiazepine because it will cause them to fall and it will increase the confusion. Anticholinergic medication is also avoid in the elderly. The preferable treatment include behavior therapy for insomnia, melatonin, low dose of dexapine. Insomnia is often a symptom of a other condition. Insomnia itself is other. Insomnia is often a symptom of other condition. Is always so thus always assist depression, anxiety, PTSD, bipolar disorder, substance use disorder. First line of treatment for insomnia is cognitive behavior therapy of insomnia. For chronic insomnia, therapy is the first line of treatment. Excessive daytime sleep is not normal aging, so you want to evaluate for sleep apnea. Depression that does not respond to the treatment may require evaluation of underlying untreated obstructive sleep disturbance, sleep apnea. Benzodiazepines are the highest risk medication for elderly. Rhythm sleep behavior disorders may precipitate neurodegeneration diseases. Manic often present with decreased need for sleep, not insomnia. I have a case study for insomnia. So the first case study is you have a patient who is reporting difficulty sleeping for 8 months and spends hours worrying about falling asleep. So this person didn't get enough sleep, and they have a difficulty falling asleep, and they spend hours worrying about sleep. What is the first line of treatment? The first line of treatment is behavior therapy, cognitive behavior therapy. We have so the second case study is you have a patient with depression, has a loud snoring, witnessed apnea, and daytime fatigue. So the patient report to you that they have depression, they snore at night, they have apnea, and they have a daytime fatigue. What is the next step? You want to evaluate for obstructive sleep with sleep study, obstructive sleep apnea, and you want it sleep study to know the causes and what quality they get, how many hours they sleep, and do they feel rested after they sleep. Our other case study is patient suddenly loses a muscle tone when they laughing and report vivid hallucination when they fall asleep. So they feel they hallucinate when they sleep. Vivid hallucination. They can tell you when they wake. So they have a vivid dreams. What is the diagnosis? Narcolepsy with cataplexy. That is the diagnosis. We have other case study. We have elderly gentleman requesting Ambien for chronic apnea. What is the safest approach? Because if you prescribe apnea, that can increase that is the risk for elderly, for falls and cognition impairment. So what is the safest approach? So the safest approach is the cognitive behavior therapy. You want to avoid sedative medications due to the fall and cognitive impairment risks. Our 50 case study is acting out dreams with violent movement during the sleep. What is the disorder? The disorder is the rhythm sleep behavior disorder. Thank you for joining me today. I would love to see you in my next video. Please subscribe. Thank you.